What led me to house calls is I truly believe it was my faith that I got called. It was not my idea. I never dreamt of doing house calls. I had done some missions work in Africa and Mexico, and someone that knew that wanted to bring this mission of house calls to our community and asked me if I'd be interested in doing it, and I said yes. So I started house calls October 18th of 1993, and what was interesting is I had been working also in a federally qualified health center for uninsured patients, and those patients, I say, were disenfranchised from the health system because they didn't have insurance, where the homebound really, even though most of them have Medicare or other insurance, they're disenfranchised because they cannot get to the healthcare system. And so the healthcare system, we started taking it to them via house calls. Well, from the very beginning of doing house calls, it was just so obvious what amazing care it was in terms of just the tremendous benefit not only for the patients but for the caregivers, and then just seeing people who had been going back and forth to the hospital and that you were able to keep them home. You also knew that there were huge cost savings. And what really has changed it is healthcare reform in the country that is going from volume-based care, where the more you do, the more you make, to value-based care, where you're really getting paid for having good outcomes, which is what house calls are all about. The win with house calls is, one, it is so wonderfully challenging in terms of the complexity that you have to deal with. But with most of life, it's the most challenging things that also become the greatest rewards when you can make such an impact on those challenging situations.